All right, I want to thank everybody for coming out for this men's symposium. My name is Dr. Terrence Craion. I am a family medicine doctor with Nashville General Hospital. So some of this, we can put a disclaimer on because some of this stuff will be strictly just coming from me, not representing the organization. But I want to thank Brother Beeman for hyping me up. It's nice to have a forerunner every once in a while. We'll just put up the slide first. So we're here to talk about men's health, which is a very important topic that often gets overlooked. Yeah. Thank you. Okay, so the topics we're going to talk about today, high blood pressure, diabetes, prostate cancer, colon cancer, and immunizations, and then afterwards we'll have a Q&A session. So I always like to start off with a scripture, and this is just kind of a part of just a mindfulness as we go through this. So just bear with me for a second. This is part of the audience participation. So just do me a favor, place your hands over your heart, and then close your eyes for a second. And just take the time to feel your heart beating, feel the air going in and out of your lungs and so forth. And then I want you to open up your eyes and look at that scripture, and we're going to read it together. So we'll begin. I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. Amen. So the first thing I wanted to talk about was the importance of health maintenance. So just kind of an audience participation thing, just raise your hand. How often do you change the oil in your car? If you know that, just raise your hand. Okay, good. How often do you rotate your tires? Just please raise your hand. Okay, good. And when to get new tires? Please raise your hand if you know when to do that. Okay, gotcha. And what about changing your wiper blades? You know when to do that? Okay, great. So do we always wait for the check engine light to come on before we do those things? Okay, so that's the same approach I want people to have when we're talking about general health. Okay, so even if you feel okay, there's nothing going on, it's okay to get checked out. Okay, because you never know when that check engine light is going to come on. So kind of joking fashion, but typically these are the three things that bring a man to a hospital or to see a doctor. One, let their feet hurt. For sure, that will bring them in. The one in the middle, does anybody know what that is? The little blue pill? Viagra, okay. And then the other thing, Brother Beeman already talked about it, your significant other, your partner, okay. I can't tell the number of times where the wife or girlfriend has been there and said, tell him what's going on with you. And, eventually it'll come out. But typically, those are the three things that brings a guy to the doctor's office. But we don't always want that to be the case. Okay. So this is not a complete list of all that general health screening we can do, but these are typical things we want to check for, such as high blood pressure screening, cholesterol, diabetes, colon cancer, prostate cancer screening, and immunizations. So let's talk about blood pressure. Some of us have some folders, we can take that out. And this is something to have in hand, because some people are audio learners and some people are visual learners. So you can kind of reference this sheet right here that talks about high blood pressure, just from time to time. Okay, so a normal blood pressure is 120/80. That's been the standard for a long period of time. We've kind of recently developed this pre-hypertensive and stage 1, stage 2, and as far as blood pressure. So pre-hypertensive is that 120 to 129, 80 to 89, give or take, as far as pre-hypertensive. But our concern is when it gets consistently 140/90 is when you start talking about people having high blood pressure. And the reason we're concerned about high blood pressure is we want to prevent all these things that could potentially happen when people's blood pressure is high and it goes untreated. You can have stroke, vision loss, heart failure, heart attack, kidney disease, sexual dysfunction, okay? So these are the things that we want to prevent. But does anyone know what's the most common symptom of high blood pressure is? And if you said none, you are correct, okay? That's why it's called the silent killer. Also, when it comes to high blood pressure, about 90% of the time, we don't know why people have it, okay? Could it be family genes, diet, exercise, or lack thereof? Yes, yes, and yes, okay? Multifactorial. Other 10% may be something like sleep apnea, kidney disease, thyroid disease, okay? But you also want to make sure that you know your family history, and we're going to talk a lot about that, or bring that topic up quite a bit, is to know your family history. You do want to make sure you do diet and exercise, okay? Because I'm going to show you this really long list of potential medications that we can use to treat high blood pressure, okay? These medications are great to help lower your blood pressure, but you never want to neglect diet and exercise, okay? What we call lifestyle modifications. Now, I often get asked, what should I eat? How should I work out? So I always turn the question around is, what do you eat? Let's be realistic. If you're in your 20s, 30s, 40s, 50s, 60s, and so forth, you've been eating whatever you've been wanting to eat for that whole entire time. So we have to be realistic. So I always say, what do you like to eat? And let's find a healthier way with what you're eating right now and incorporate more healthier options, okay? I think that's a more realistic approach. If I go up to you and say, hey, from now on, I just want you to eat nothing but salads, what would you guys think? Okay? So, not realistic, you're gonna go out the door, and you're gonna eat whatever you wanna eat, okay? So same approach when it comes to your diet and so forth. Same thing when it comes to exercise. If I go up to you and say, hey, join Planet Fitness, what would you say? Okay, how many of us have gym memberships that we're not using right now? Raise your hand. You're paying that $10 a month and you're not using it. You're not using it. Thank you, brother. So when it comes to exercise, I always start off with, what do you like to do for exercise? Some people like going to the gym, some people don't. Some people like going for a walk, bicycling, swimming, whatever. Whatever gets you moving, that's your form of exercise, that's what I need you to do. Because one, I want to make sure you enjoy it and that you look forward to it, because you're more likely to stick with it. Make sense? Okay, gotcha. Really quick synopsis on this, as far as like all these blood pressure medications. We're primarily affecting three things: the pump, the pipes, and the filter. Your pump is the heart, your pipes are going to be your arteries and veins, and your filter is your kidneys. We're just manipulating one of those three things for the most part. And that's what we do when it comes to correcting people's blood pressure and deciding which blood pressure medications we're going to prescribe. Okay. So type 2 diabetes. How many people know the difference between type 1 and type 2? Okay. Okay, great. Okay. So typically type 1 is usually a younger person, and in this instance they don't make enough insulin. And insulin is the key to take the sugar from your bloodstream inside the cells. Type 2, you make some insulin, but it's not quite effective enough. Essentially, it's like having a wrong set of keys to your house, if you want to think about it that way. Usually, type 2 diabetes are older people, but I'm seeing it more and more often in people in their 30s and 40s, where before we used to think about 40 and above as far as type 2 diabetes. Does anyone know the signs and symptoms of type 2 diabetes? Raise your hand. Oh, okay, gotcha. For the most part, again, this kind of goes to the same thing with high blood pressure. It's oftentimes you don't have any symptoms, but some things you may be looking out for: sudden changes in your vision, numbness and tingling in your hands, feeling thirsty all the time, feeling like you're peeing a lot. Does any of this sound familiar? Okay, because these are the symptoms that sometimes people may mention, and sometimes they feel completely fine. Roughly, I think it was 1/3 or so of people are pre-diabetic, and they can be in that stage for 5 to 7 years before they actually show any type of symptoms. Again, they may just find out on the regular routine at the office visit. I've had 3 patients in the past month. I diagnosed them with type 2 diabetes just by checking their urine. Okay? No other symptoms other than doing a normal urine analysis. Okay? So type 2 diabetes is huge. Okay? If you combine prediabetes and diabetes, you're talking roughly almost 50% of all Americans have one of those 2 conditions, and they may or may not know it. Again, there is a handout, this one that talks about diabetes in the United States. And then there's also a pre-diabetes on the back of that same sheet. So just something to reference later on, okay? I like this slide because it talks about the cost of diabetes. Oftentimes we kind of overlook like illness does have a cost. In financial sense, you know, you're talking about almost $14K a year spent between medications, doctor visits, time missed for work in case, you know, diabetes is out of control. So that's a serious, you know, dent income. I mean, like how many people would like an extra $14K a year? Oh, not too many, huh? Okay, all right, well, good to know. Again, you never want to overlook maintaining a healthy diet, losing weight, and a regular exercise. Because the more you exercise, you take that sugar that's in your bloodstream, you're going to take it into your muscles, so you can use that more efficiently. So that's the kind of way to think about it. Okay. Let's talk a little bit about prostate cancer. So these are 3 individuals who just were in the news in regards to prostate cancer. Montel Jordan, I think he was in People magazine, just announced that his prostate cancer actually came back. So I believe he had a surgery to remove his prostate, and it came back after routine screening. They found it again, so he has to go radiation therapy. Alonzo Mourning is now doing a campaign with the American Cancer Society, where he just announced that he had prostate cancer. He said he didn't have any symptoms at all. And then Joe Biden was recently in the news because they found his prostate cancer. Okay. Just by show of hands, does anyone know what a PSA is? Okay, great. So when it comes to prostate cancer, typically the people who are most at risk are between 55 and 60, give about that time frame. African American men, and then if there's a family history, particularly first degree relatives, dad, brothers, those people are considered your first degree relatives. So the way that we can test for that is called your PSA, prostate specific antigen, which is a blood test that we use to draw. Normally it's between 0.45 and 4.5. When it gets over 10 is when we start to really get concerned. Depending on which provider you go to, they may just kind of watch it. If it's kind of like in between that 4.5 and 10. If it's over 10, we're probably going to send you to a urologist. Has anyone had their prostate checked? Okay. How many did the blood test? Just raise your hand. Okay. How many did the DRE? Okay, I'm glad you asked. So DRE is the digital rectal exam. It's like real estate, location. It's the best way that we can feel for the prostate. That has somewhat fallen out of favor, thank God, for most docs. I just leave that up to the urologist. I'll do the blood test. But that is one of the reasons why men won't go to the doctor, because they don't want to do it. Yes, it is embarrassing. Yes, it is uncomfortable. Yes, it is awkward. But sometimes we got to do the things that we need to do, not only for ourselves, but also for our family members. Okay? So can your PSA, there's a Q&A, if you just want to hold on. Oh, okay, gotcha. I lost my train of thought. PSA. Oh, why men of color are more at risk. And what they did is when they did the study, they found out that the genes that affect or cause prostate cancer tend to be more aggressive in us. So not only do we have delayed detection, okay, the cancers that we get tend to be more aggressive. So that's why prostate cancer tends to be more detrimental in us. And I think yes, there is one additional handout that talks about prostate cancer fact sheets, so you guys can take that home as well. I do have one patient story to tell. I recently had a 60-year-old gentleman who came in for his routine physical, did his blood work, PSA came back at like 7.7 or something like that. And, you know, for whatever reason, I think it was God, I sent this gentleman to the urologist, and it turned out to be early prostate cancer. So, you know, some of my colleagues here could probably testify that I probably would have been justified just to wait and see what happens. But I don't know how advanced his prostate cancer could have been the next time we check it, okay? So know your family history, get your PSA, don't worry about the DRE, get the blood test. It makes you feel more comfortable, more confident to come in and see the doctor. So this is just some additional facts on prostate, okay? And this is some of the information that's also in that sheet as well. Colon cancer. Many of you know Chadwick Boseman. Okay. When he was diagnosed with colon cancer, he was roughly 38, if I'm doing the math right. I think he was stage 3 when he was diagnosed. And sadly, he passed away in August of 22 at the age of 43. For the most part, I would still often think, like, if he was my patient, if I have pushed for a colonoscopy, okay? If he didn't have a family history, didn't know his family history, I probably would not have. So I don't know if even, you know, most physicians would have caught it. I'm assuming he has some type of symptoms, and that's what took him to the doctor. So it's very important to know your family history when it comes to colon cancer, and I'm about to explain that in a second. So this gentleman here is named Keith Harkins, okay? He was my brother-in-law. He went to the doctor on his routine checkup because he was having really bad acid reflux, okay? So they put him on an anti-GERD medication to help him treat his acid reflux. Came back in a month, said, hey doc, it's not getting any better, it's getting worse. So he ended up getting a scope, what they call an EGD, from the top down, and unfortunately found a really aggressive cancer, okay? The reason why I'm bringing him up is because he's actually the cousin of Chadwick Boseman. They're both from Anderson, South Carolina. And when I was talking to my sister about this, she gave me permission to share Keith's story, just as a point of knowing your family history. And she let me know that a lot of his family members have cancer in their family. And because of this knowledge, we're more than likely to screen his family members earlier than what we normally recommend. Typically for colon cancer, we start at age 45 to start screening. If you have a family history, we're going to start earlier. It used to be 50. Now they took it down to 45 because there are a lot more people who were testing positive for colon cancer and being more advanced at the time of diagnosis. Okay. Typically, what I usually recommend is either the colonoscopy or the Cologuard. Whichever one you want to do is your preference. How many people have had a colonoscopy? Okay, good. Now the prep is nasty. I don't care what anybody says, it's nasty. Particularly that second one that you had to drink. Yeah, I was thinking, God, why'd you let them create this? This is horrible. But once you get that done, everything's negative, you're good for 10 years. If for whatever reason that doesn't work out for you logistically, as far as getting into the doctor's office and so forth, do the Cologuard, okay? If that's negative, you're good for 3 years, okay? The key is just to get some type of colon cancer screening done. How many people are familiar with the Cologuard? Okay, so Cologuard, is the little white box that comes into your house. You've probably seen the TV commercials for it and so forth. You do your business as usual, ship it back to them. They give you a result, you're good for 3 years. That's how Cologuard works. So either one that you choose is okay, just as long as you do the screening. This is just a little bit of information about colon cancer, how they switched the age down to 45. There are certain conditions where you may want to get it done earlier. If you're like Crohn's disease or ulcerative colitis, that may be a reason to know or to relate to your doctor so you know to get your colon cancer screening done earlier. Okay. So let's talk about mistrust and misinformation. There is a lot of mistrust and information in our community in regards to healthcare, and as noble as our profession is and that we try to be, we have a history within the health fields that have not been kind to us. And we have to own that and we have to admit to it. We got to make steps to correct that. So examples would include the Tuskegee experiment, where men who had, I think it was 299 men, actually had syphilis, and they allowed it to progress just to see the steps that would happen if they had syphilis and it was not treated. Even though they did finally have a cure for syphilis, they still allowed it to progress. It wasn't until 1972 where someone blew the whistle and just kind of put it into that experiment and so forth. So this is the reason why we have so many strict regulations when it comes to clinical trials and so forth, and why you go through all this process and why people are considered protected under certain conditions, such as if you're pregnant. How many people know who this lady is? Show your hands. Okay, gotcha. Do you mind telling them who this lady is?
I believe that's Henrietta Lacks.
Correct. Does that name sound familiar to anybody? Okay. So Henrietta Lacks unfortunately suffered from ovarian cancer. She was being treated at Johns Hopkins University, and unfortunately her disease progressed, and in 1951 she passed away. But the doctors who were treating her took some of her cells without our permission, didn't tell her family, and they've been using it for research. They have been using it for research ever since then, because her cells are still circulating, they're still reproducing, okay? So there have been probably billions of dollars of profit that have come from using her cells. And the family didn't know about it till years and years. I think decades, like maybe like in the 70s they found out or something like that. So I think just now recently they reimbursed the family, or I don't know if reimbursed is the proper word, but gave them some financial compensation for what their loved one's cells were used for, okay? So essentially, she's the reason why we have informed consent. You know, when you go to the doctor's office, they say, hey, here's this form, read it, sign it, make sure everything's okay. So one of the ways we could combat mistrust and misinformation is sessions like this, where we talk to each other, communicate with each other to make sure that we're passing along valid information. You want to have a good conversation with your own primary care doctor in regards to some concerns you may have. Skepticism is good on some level, but you don't want to take it too far, okay? Because there's a lot of stuff that's on the internet that's sometimes someone's personal opinion, or is not really based on scientific study, okay? The other thing would be making sure there's more people that look like us who are in these doctor rooms doing these clinical trials to make sure like things like this don't happen again, okay? Just out of curiosity, does anyone know how many physicians in the United States are of African American descent? How many people say 20%? Just raise your hand. How many people say 10%? Okay. How many people say 5%? The correct answer is 5%. We make up 13% of the US population, but only 5% of the doctors. For the STEM fields, I think we're 5 to 7% as far as reputation or representation. So, vaccines. This is just a diagram that talks about the different vaccines that adults can get. And it can be a little bit overwhelming, just kind of looking at that. In combination with like the mistrust, people often say, hey, I don't want to get the flu shot, I don't want to be a guinea pig, and so forth. So let's dispel some of the myths about vaccines. When it comes to any vaccine, I want you to think about it as pretty much like a seatbelt, okay? So it does nothing to prevent you from getting into a crash, but its main job is to keep you what? I can say it louder, y'all right? Safe. Thank you. So think about it this way. If you got into an accident and you, like the next time that you're in a vehicle, you say, hey, I don't want to wear a seatbelt again because I got into an accident the last time I was in a vehicle. Would that make sense to you guys? Okay. So when it comes to vaccines, I want you to think about them this way. Think of them as seatbelts, okay? So when it comes to vaccines, there's two concepts we need to balance. Body autonomy, okay? The right for you to say what can go to your body, what can be done to it, versus the good of the public health, okay? So that's where we're always balancing when it comes to infectious diseases and why we do these vaccines, okay? Some common misbeliefs about the flu vaccine, because I get these a lot. When you get the flu shot, okay, you're basically training your body to recognize the actual, real, live flu vaccine, okay? So you're not getting the flu when you get the flu shot, okay? It's actually what we call inactivated. It means it's been killed, okay? Can I have you stand up for me, Brother Cash? So a lot of people want to know why we can't cure the flu. So if Brother Cash represents the flu, we're taking an educated guess to say, hey, everybody in this colored shirt, this is what's going to be in the vaccine. Now, take the challenge of guessing 1 year from now what outfit he's going to be wearing, okay? So that's the difficulty of trying to find an actual cure for any type of virus or bacteria or stuff like that, because the viruses, their main job is to reproduce, okay? They don't care who you are, how much money you make, where you live at. All they want to do is reproduce. Thank you. So COVID-19, I picked this one because it's most recent, and there's a lot of controversy back and forth about COVID. Just some facts about COVID-19. It was, how can I put this? So there are multiple viruses that are under coronavirus, okay? But this was a new mutation, okay? It's the equivalent of a new baby being born into your family. You don't know what to do with it. Same thing with our bodies. When we were exposed to COVID-19, we had no idea what to do. So that was part of the reason why we had such drastic measures and so forth. It did cause a global pandemic. As of today, it's caused over 1.1 million American deaths. Now, if you think about that, that's almost the population of Dallas, Texas, okay? And it's not just those 1.1 million lives, it's their families that are affected, their co-workers, their community, their churches, and beyond, okay? So it had a great impact. It actually cut down the life expectancy in the US by 2 years. Okay? So we have plenty of tools, antivirals, vaccines, hygiene, masks. The most vulnerable were the elderly and those with a weakened immune system. Typically those with diabetes, cancer, those type of things. There we go. So during COVID, I was essentially the hospitalist for our clinic. So this is me and my protective equipment here, the PPE, and the other picture is me actually getting the vaccine. I will say that, yes, I am pro-vaccine, but for everyone else, I want you guys to have an informed decision and talk to your doctors about the vaccines that are appropriate for you, okay? So, yes, I would love for everybody to get vaccinated, but remember, body autonomy, public health, okay? We're always gonna balance those two. So just have an informed conversation with your doctor is what I'm advocating for. Make sense? I keep on turning the wrong way. Q&A. Does anyone have any questions? Can you please state your name for the... No, I was kidding. Go ahead.
So the first question I have, I know when you were talking about the prostate cancer, I know that I think it's a well-known fact that a lot of men don't like to go to see their doctor, especially African Americans. And so since there's such a this attitude of not wanting to go until, essentially it's too late, at what age for African American men should they have their prostates checked?
I start at 40, checking for PSAs. If there's a family history, I'm going to check earlier and more often. So I would typically say 40. So for my patients, I just check 40 across the board, going up regardless.
And one more question.
Sure.
Because I know certain doctors, push certain tests. So outside of a PSA, is there a time that you would recommend the DRE for confirmative, or no?
Yes, when I refer you to the urologist.
Okay, gotcha. But say you're not doing it.
I'm not doing it.
Okay, gotcha.
Any other questions?
On
Can you wait for the mic? We're just gonna.
on type
We're streaming.
2, on type 2 diabetes, when he talks about frequent urination, is there a standard to know what frequent urination is classified as? What do you?
I don't know there is a exact amount of how much urinating. It's the combination of symptoms. What usually happens is that because the blood sugar can't get inside the cells, the extra blood sugar gets filtered to the kidneys, and from there it goes into the bladder. Now, where sugar goes, water goes, so it fills up your bladder quicker, and therefore you urinate more often. Okay, so that's typically what happens. So people may say, "Hey, I feel really thirsty. I feel like I can't quench my thirst. I keep on urinating a lot." And then, like I said, you may just find it by accident, like just checking someone's urine, and you find sugar in the urine. Who else had a question?
Yes, as far as the flu shot, and you said it don't make you sick.
It doesn't give you the flu. What you're feeling is the reaction of your immune system responding to the vaccine. So you may feel muscle aches, low-grade fever, you may feel a headache. Okay, those are flu-like symptoms because whatever your body is exposed to, it generates the same response because it needs better cavalry to recognize the virus and to react quicker to it. So that's all you're doing with the vaccine. So some people assume that, hey, you gave me the flu, and what they're not realizing is that your body is just responding to the vaccine.
That was actually my question. I was just going to ask about the flu because being a supervisor at work, somebody will say they're going to get the flu, and then a week later they're calling in saying they have the flu. So that's what I was going to ask, the same thing.
Fair enough. And it makes sense because sometimes people think the last thing that happened to them caused it. Okay, so that isn't always the case. Like, for instance, if someone has the stomach flu or the stomach bug, it isn't necessarily the last thing you ate. So just kind of think about it that way.
What does it mean when you urinate a lot? Does it have to do with the type 2 diabetes?
That would be one of my suspicions. So that's why I would say we just do a quick urine analysis just to make sure that isn't an issue. But that would be the first thing I would want to eliminate. Oh, okay.
Was going to ask you to describe what a urine analysis is. Some people may think,
Sure. So what a urine analysis is, so you give a urine sample, and we'll take a strip, we'll dip it, and we'll analyze it. So what we're looking for is sugar in the urine, protein, blood, white blood cells, those type of things. Something that may indicate an infection or something going on with your kidneys. It may need additional testing after we do the urine analysis to say, like, hey, something's off. Like, this should not be here, and that can prompt us to do some additional testing. Pretty quick test. Do it when you're in the clinic. Next question.
What's the difference between A1C test and a blood sugar test?
Sure. An A1C test is basically a long view of how well your blood sugar has been controlled. Typically over 3 months, because that's the lifespan of the red blood cell that contains the hemoglobin that we're measuring. The blood sugar that you're talking about is when we do a blood draw or we poke your finger, and that's what your blood sugar is in that exact moment. So that's the difference between the two. So the other way I'm trying to get people to think about it is imagine yourself at the Grand Canyon, and you want to take a really nice picture of the Grand Canyon. Would you use the old school Polaroid camera or the panoramic view on your smartphone? So, I got an applause on that one? Okay. So the Polaroid camera is the one you're doing when you're testing your finger, or you're drawing the blood, and that tells you what your blood sugar is. But if you can take out your smartphone doing a panoramic view, that gives you a greater idea of what's going on as far as the blood sugar control.
So why do doctors sometimes skip the A1C and just do a blood sugar? I mean, is that good practice to do that?
I don't know if they're skipping it. Typically, we do it once every 3 months to check the A1C. That's typically how it's done. Hopefully, they're not skipping it, but that should be the reason why they may not test the A1C as often as they do the POC glucose. Or I'm sorry, POC is point of care, what they do right in the instant, checking your blood sugar. Was there another question?
How can you trust that you're getting the correct vaccine with today's political climate without being self-directed, giving opposite information compared to what's been given?
Gotcha. So that comes with having a good relationship with your primary care physician. Also, like I said earlier, representation matters, making sure we're in these fields to make sure that we're doing right by all people. When I went to a conference in, I think, April of this year, one of the things they talked about is that when there is a physician of color in the community actually does better health-wise. And I believe that's part of it is because we're more culturally aware and more culturally sensitive to the needs of all of our patients. So we do have that extra benefit. Also prayer. Any other questions? No? Oh, I'm sorry. Can you put that back up for me? Sorry. So I wanted to dedicate this talk to my aunt. She was the one that recently passed away, and I went to her funeral in Detroit. She was a retired cardiac nurse, and she's part of the reason why I'm here in front of you talking to you guys today. One time she caught me looking at her textbooks, and she asked me was I interested in what I was looking at, and I told her I did. So she tried to teach me how to read an EKG. Okay, that didn't work till med school. But the fact that she, put a spark in me to actually pursue medicine. So I just want to dedicate this talk to her. Thank you. Oh, you want to use this one? Oh, no problem.
Can I hit him with the Richard Simmons?
Yeah.
Thank y'all for coming out. God bless you. Good night.